Hello everyone, it's me Dr. Ayaz Ahmed, working as an aesthetic dermatologist. You are watching my YouTube channel. Today I have selected another important topic for you. The name of topic is Mycetoma. Mycetoma is a nut tumor. It's a basically localized chronic infection by various species of fungi and actinomyces, characterized by the grain within abscess, resulting in damage to the skin, subcutaneous tissue, bone of feet, hands, and other body parts. Grain discharge through draining sinus. It is also known as the meduromycosis or medura foot. Introduction, general description, epidemiology, age, sex, and ethnicity. It may occur due to eumycetoma and aerobic mycetomites, which occur as a spore in soil or in plants. These spores within the soil or from the plant get inside subcutaneously via injury. It's a common in tropical and subtropical areas, especially among those who are agriculture worker. It may not cause any problem or it may not be troublesome for up to 20 to 30 years after initial injury. Actinoma, actinomycetoma caused by the Nocardia species is common in Mexico and Central America. It is rare in children. Males are mostly affected. There is no ethnicity predisposition. Pathophysiology. Fungus or actinomyces, as I have already discussed, these are the causative agents. They usually survive due to grain or cluster formation within abscess, which aid protective matrix, cell wall thickening, and melanin in the cell wall, and also surrounding matrix. Melanin is also protective against antifungal by binding these molecules. Pathology. The pathology includes neutrophilic abscess formation, scattered Gantt cells, fibrosis, grains of yellow, white, red, or black color may be seen, grain discharge pus through sinus on the skin, involvement of muscle, tissue, and bone. Hematoxylin preparation is needed to differentiate these species. These are the species which are usually involved in mycetoma. These are the actually fungi. Those fungi which produces dark grain are Medura mycetomatis, Medura gracie, Leptophilia sanguinensis, Coccolobolus lunata. These four produces dark grain color. Those species which produces pale grains, these are Pseudospirum, Apospirmum, New Stati, Tudina rosati, uh, Cerolatidum species, and Fuserum species. Another actinomyces are Actinomedura, Actinomedura pelliteri, Streptomyces, uh, somilensis, Nocardia brasinensis, Nocardia otitis cavirum, and Nocardia astrorite species. So these are all the species of fungi which produces different grains. Clinical presentation. Clinical presentation are firm painless nodule. These are the first appearance, usually on the foot and lower leg area. Then papule and pustule appear with draining sinus on the skin. Area become hard and swollen. Involvement of bone and joint with deformity may be seen in later stages. This is a foot of a farmer. You can see there are small, actually these are the pustules with draining sinus. They first appear as a nodule, hard painless nodule would then become papule and pustules. Then they discharge pus through draining sinus. These are the actually draining sinuses for the discharge of pus from the foot area. It may first become swelled, hard, and then pustule discharge pus. This is the involvement of a bone in late stages. You can see bone is fully eroded. It usually takes many years after the infection. This is the foot of a patient with mycetoma after many years of its involvement. You can see involvement of the skin, muscles and bony structure. Here in this case, amputation may be advised. Differential diagnosis, complication, disease course and prognosis. In differential diagnosis, number first is the chronic osteomyelitis. Because within chronic osteomyelitis, bone is involved. Here in case of mycetoma, bone is also involved. Complications related to the bone deformity and osteomyelitis are kept in differential. Prognosis is not a good, leading to deformity and reduced mortality, but it may be fatal. Investigation: examine the pus which is drained through the sinus in CoH solution or potassium hydroxide solution directly or under microscope, and then perform histopathology. If the infection is due to mycetoma, then fungal mycelium with hypha of 4 to 5 micrometer will be seen. If infection is due to actinomyces, grain will show narrow bacterial filaments of 0.5 to 1 micrometer in diameter. Tentative diagnosis may be considered on the basis of grain colors. Another investigation is biopsy and then culture. This is the histopathology of mycetoma patient. You can see these are actually the hypha. These hypha are involving the periphery of this slide, while another big portion of this slide is pale in color, while those involving hypha, it is pinkish in color. You can see at the margin. Most frequent species that are involved in causing mycetoma, these are the Medulla mycetomatis. It is the most frequent species. It usually found in colonial form. Initially yellow or leathery, and then within few days it becomes olive, orangey brown or grey in color. It may produce brown pigment. They grow best at 37 degrees centigrade. Microscope shows spherical candida. Second most frequent species is the Pseudosporium apospermum. Colony rapidly grow with flucose gray or brown gray surface with white to dark gray reverse. Microscope show oval light brown thick walled candida with tourniquet base. Now let's come to the management. First line and second line. In case of actinomyces, the combination of dapsone with streptomycin or the combination of cotrimazole plus streptomycin have good result. Although rifampicin, amikacin, imipenem may be used in nocardia infection. Mycetomatis responds well to ketoconazole. Second line treatment is usually radical surgery, usually by amputation. Thank you very much. Stay connected and subscribe my YouTube channel.